Rick, welcome to Matcha Minutes, where we talk about what's going on in our community. I'm Joe Wilson, the CEO of Matcha IT, and today my special guest is Rick Naegler, the regional CEO for Prime Healthcare in one of the hospitals is St. John's Hospital. Is that right?
That is correct. And Joe, thanks so much for having me. I'm honored to be able to sit here and have this conversation with you today.
Well, we've been trying to get you for a while. We had Billie Leonard. Billie did a great job. She had a really a lot of views on her podcast. I know I talk about her a lot. I think she's an exceptional person. I think she's doing great things in our community. And so when she spoke highly about you, and as I've gotten to know you on the St. John Hospital board, I really thought it would be great for you to get on here and talk about the exciting things that are going on in our community.
Great. Yeah. Honored once again to be here. I don't know if I can overshadow anything that Billie's done. I mean, I concur. She's an absolutely great person.
Well, you're gonna have tough shoes to fill, but we're gonna give it a shot. First of all, for people who don't know you, why don't you tell us what your story is? How did you come to Leavenworth? How did you get involved in healthcare? Who is Rick Naegler?
I tell you what, that story, actually, the older you get, gets a lot
longer. We had 45 minutes.
Yeah, exactly. That's what I was going to say. I mean, now at my age, that story gets kind of long. Well, I'm originally from Springfield, Missouri. That's where my hometown was, and once I left Springfield, I joined the military. And I became a medic in the Army, really from 1988 to about 91 was when I was finished. So it was during the height of that Desert Storm time frame medic. And I went and got my paramedics license out in Colorado and then moved back to Springfield.
You did this right out of high school?
Did it right out of high school.
Okay.
And so I did it because I needed to earn college money, to be honest with you. And the GI Bill was there, and wouldn't trade the experiences for anything. The timing I was in, the recruiters didn't quite tell you we were quite getting ready to go invade another country at the time, but it turned out to be probably one of my more proud moments in my life, being able to do it. Came back to Springfield.
One more question.
Yeah.
Did you serve in combat during that time?
I did.
Oh, wow.
Yeah, I did.
You were deployed to?
I was actually stationed out of Tel Aviv, Israel, and I was part of the Air Battalion out of Fort Carson, Colorado as a flight medic. So we flew missions all over the place.
Wow.
So we actually didn't. We moved a lot, so I didn't have just a spot, and it kind of depended on where we were going from a battalion standpoint to be able to go and support the troops and what we're going to do. Mostly there, it was kind of crazy. It was self-induced injuries, which we were lucky for, but you were trained. You were trained to do it. But you tell you what, it makes a young man grow up pretty fast.
I can only imagine.
Yeah, absolutely. So I took those experiences and came back to Springfield and started working night shift, believe it or not, as a nurse assistant on a urology floor. And worked night shift there. And then I was young and poor. I drew blood in the emergency room as a phlebotomist. I picked up time on the weekends as a burn tech in the burn unit, and went to nursing school full time. Put myself through RN school. Wow. And so, yeah, worked full time. That's my old. I walked 50 miles with no shoes on. That I like to tell the younger people, but at the end of the day, I got into nursing, and having my EMS background and all the things I did, I thought I was going to go work in the ER. Well, this is crazy how time was. They only had 2 full-time job openings. So imagine that in today's world where you can't get enough nurses for anything. And I actually went into work in one of the ICUs. And so I spent about 6 months there before I went back down and became a leader. I became an assistant director in that emergency room. And people ask me this day, sitting there, he's like, well, what got you into leadership? What made you do that? And I said, well, it's pretty easy. I walked in one night and the house supervisor said, congratulations, you're in charge. And I didn't really know what that meant, but it grew on me, to be able to lead other people into creating a vision and creating a mission and taking care of our patients. And I liked knowing a little bit about everything. So consequently, I went back and got the degrees to support that. And so I've got a degree in healthcare management, a master's in healthcare administration. I got my nursing degrees as well. And I've really, over the last 38 years in healthcare, still like, what does that mean to be a leader? Well, I tell you what, I think you evolve every day. I think you grow. I think you learn. I think you have to listen to your community. You have to listen to your staff. So I just continue to evolve and try to do the best I can at it.
How long ago did you become the CEO?
So, gosh, you made me do math. About 18 years ago. I got my first shot as a CEO. And I'll tell you that's a trek. After I was in Springfield, I left and went to Florida.
Oh, wow.
And I had an aging parent, kind of the same story where you become sandwich generation. And we went down there for when my dad was there. And I spent about 13 years down there. And I was working for HCA at the time. Great company, taught me a whole lot about how to be a really good hospital operator and what I was trying to do. And they saw my worth, and I was able to promote fairly rapidly through the systems, from nursing officers up to VPs of service lines, and then ultimately got into a CEO seat.
Wow. So, you went into the Army as a medic. Why a medic versus any other role?
I think it's interesting. So we actually ask these questions to people that are getting into nursing school or getting into leadership. And it's kind of, my story is not unique. I had two parents that were not healthy. So even as a little kid, I was always in hospitals. And I joke that I went into healthcare because I like the pork tenderloin sandwich in the cafeteria. I joke about that, but there for a period of time, dinner time for me was in a hospital.
Wow.
Because my parents were always sick or in and out of them. So I had a familiarity with it. I had the way it smelled, the way it looked, looking at the doctors walking around, just you pick that up early in your life. So you walk into a recruiting station, they say, what kind of job do you want? President of the United States wasn't open at the time. So I said, what about something in healthcare? And they make combat medics seem a lot more glamorous than that. But
the gotta be one of the hardest jobs.
All of them are hard, and I respect all of them. But it was definitely an honor to wear the badge as a medic in the military and support that. So it prepares you for life in a lot of different ways. So that's really what got me into healthcare. So I think the familiarity of being in healthcare and being around parents that were always there, it was natural. I was actually walking through Providence Medical Center the other day and thinking, man, you just have a smell in it. It takes you back into when you were a kid. So it's like, I've been in hospitals my whole life. So
how do you think the military prepared you for this role?
I think it's taught you structure. It taught you, it's military. And if you think about it, a lot of things that good companies will do still have a very militaristic algorithm to it. Airlines, same things, all your safety checks, getting that airplane ready to fly. I think the military taught you discipline. It taught you, for me, pride of country.
Sure.
You figure out at 18, 19 years old that this whole world's a lot bigger than you, which is a pretty good lesson for a 19-year-old sometimes who was, 6 foot tall and bulletproof and to get the tiger by the tail. But no, at the end of the day, I think it created humbleness in you and really set me on a path to, there's a lot I don't know. So I've really created a lifetime of trying to learn.
Regional CEO, what does that mean?
So the way our company is set up, currently we have 6 regions for Prime Healthcare throughout the country. Our company is headquartered out of Ontario, California.
Okay.
And Region 4 encompasses the hospitals that Prime bought here in Missouri and Kansas. So I'm very fortunate. My travel is really by car. And I moved here to Overland Park, which was different. Okay. We had a regional CEO structure where people would fly in and cover it with that. But my role is all 4 of the CEOs at the hospitals answer directly to me. And ultimately, I have oversight for the direction of the region for the Prime Hospitals in Missouri and Kansas. And we have 2 on the Missouri side, 2 on the Kansas side. What we're going to do, a couple of surgery centers and about 15 clinics throughout the Kansas City area.
St. John Hospital has been part of Leavenworth since 1864. How does that history affect the expectations people have for you today?
So I think they're somewhat the same. And what's interesting, when I talked about my career when I started coming back out of the military, it's twofold for me. Leavenworth was kind of funny. As a medic, there was 2 things. You knew the history of Leavenworth, whether you were ever here or not, because they threatened you with being stupid. This is where you came, right? And it's like, so nobody really wanted to come to Leavenworth unless you were stationed here. I was fortunate enough that actually one of my medic buddies in the military, his dad was a longtime colonel at Leavenworth, so he would tell stories about Leavenworth, and we had this awe of the history of Leavenworth. But at the end of the day, the history of the military, but I went to work at St. John's Hospital, which was part of the Sisters of Mercy health system, fresh out of the military. And when you start looking at how these hospitals were funded in these types of communities, what the sisters did in these to come in a need where there was nothing, and they took care of people without prejudice, without money, and set these hospitals up to do what they're going to do. That's the history. That's the type of care that people want. Even though we are not governed by the Catholic Church here, we are still very involved with the Catholic Church, and we still meet regularly with Bishop Ignite and all the people we're doing to keep him updated. And we're trying to be more involved with that because we want to carry on not only the history of Leavenworth, but the history of the sisters that founded this hospital.
What is one of the strengths of St. John's that maybe the residents of the community are underestimating?
I think it's their people. I mean, I'm fortunate now. See, I've been here 11 months.
Okay.
Some people will maybe have an experience coming through where they've encountered something different than I have. But I will tell you, in the 11 months that I've been here, when I walk through those walls, those are some of the most caring, dedicated people. They want to be in Leavenworth. They want to take care of St. John. They're very loyal to the system. That's something you can build programs around. That's something you can add capital and resources to, because if you don't have the people to do that work, then you just have a building with expensive stuff in it. So I think we're primed, no pun intended, to really start growing services and doing things different in this community, because we've got such a good group. And once again, you've already talked about Billie and Leonard. She's leading the charge of that, and she sets the expectations that you got to, you think with your mind, but you lead with your heart. And this is what we got to do. And so I'm very, very happy with what we've got here for that. Service line wise, I think it's something that we're evaluating every day of how do we get more here to keep people that don't have to drive over to Kansas City or to leave our community. So, and that's a struggle that's a good thing about coming in from outside and being over systems in other places. The same dynamics happening in a lot of different places at smaller communities are losing specialists, and everybody's funneling them to go to the big house, where really my play is just what can I start adding here so people don't have to make that drive. So, and it's a work in progress.
What are some of the services that you guys do provide for somebody who may not know or may remember the old St. John's, or, who possibly haven't gone there today or recently, and they still have a bad taste in their mouth?
Yeah, sure. I mean, actually, one of our number one service lines is our senior behavioral health unit, which has been a godsend for this type of community, because those patients come from far and wide. To be honest, I was actually sitting with that team early last week, and we actually had a patient from Iowa got transferred right here into our hospital. But great emergency room care. We've got great family practice and community care for people to have preventative medicine, imaging. We have everything but an MRI right now, but I'm actually evaluating bringing that into the community. You can be admitted up to our critical care unit. Now, if you're intubated or things like that, you would probably have to be sent to our sister facility at Providence. But right now we're working on, I was talking to Billie this morning about that actually. What can we do to maybe get that a little bit higher? Our hospitalist team right now, led by our CMO, Dr. Dennis Tremolo, fantastic group of physicians. This community has top-notch doctors working in what someone would consider a small community, small hospital. This man can work in any hospital in the country and do great. And so it's those types of care levels. We got a med surg unit with what we're trying to do. And then from an operating room standpoint, we can do just about anything that's done down in the Pavilion, mostly in the outpatient center. But in today's world, most surgeries are being pushed to the ambulatory care space anyway. So we're kind of set up to be able to do that really well. So those are some different expandabilities and other service lines we're trying to recruit into the community.
I think it's incredible, because I think people have this view of St. John's as a small town hospital that is easily overrun or overfilled. I know as city commissioner, when we were talking about Core Civic, one of the things was our little hospital can't handle X, Y, or Z. That's simply not true. You guys are a full service. You guys handle a lot of stuff right now, and you guys could pretty much handle anything that were to come our way.
Through that emergency room, I'll tell you right now, we're blessed with our medical director. He's actually a military man, and actually as a physician for special forces, that I will tell you, if you're hurt, injured, or sick, our emergency room can handle just about anything a level 1 trauma center could take care of in an ER. The difference is that would be something that we would stabilize very well and then get to a bigger facility to handle those injuries. Same with our STEMI times. Like if you're having a heart attack, you can come in. That's one of the misnomers, is I should drive to the hospital, or I tell you what, I'm going to get in a car and I'm going to drive 45 minutes somewhere else. The partnership we have, and what I'm really trying to bring from a regional approach is that St. John's is attached to Providence, and Providence, if we don't have it, does have it. So like if you're coming in with a heart attack, we can stabilize, give you those medications, shoot, move, and communicate. And if you can get that artery open within 45 minutes, that's better than some hospitals if you walk in their ER and you just got to go up 2 floors. Mm-hmm. So we have that, and we track that. We look at that. So, I mean, I want the community to feel comfortable that our skill level is on par with everything that we're trying to do. So,
you guys,
I would have no fear of this being my hospital if I lived in Leavenworth.
What about pathogens? I think people after COVID are worried about pathogens.
I don't think there's anything out there that's going to get people. I still think we're dealing with the effects of what COVID actually did to us, which I'll promote. That's why you really need a primary care physician. That's why you really need to get checked. I think, there's certain little ailments that just don't go away as quick as they used to. And I think it's some of this unknown effect of COVID with what we're trying to do. I think COVID taught us a lot. I mean, you think about it, you start talking about the military type things, and you have we actually were in the first time a mass pandemic scenario, probably in the history of this country that I can remember, that we had more modernized medicine in, and it hurt us. I think it showed that overall throughout the country, we weren't completely prepared for that. Moving forward, how are we prepared for that? Well, first and foremost, it goes back to, I think it created a different awareness that you wash your hands. Mm-hmm. I think if you are sick, maybe put a mask on. If someone's sick around you, ask them to put a mask on or put one on around you. So I think that sense of community awareness is different. Immunizations, I'm big on immunizations. Make sure you get your shots. I mean, I came from a generation when I was in the military, I had probably more immunizations.
Every shot than you could possibly imagine.
I probably things I don't even know. Mm-hmm. But I didn't get that sick through COVID, so I don't know maybe they gave me something there. I don't know. But at the end of the day, from a pathogen standpoint, I think it's under control. I think as a community, preventative medicine, watching for the signs and symptoms, putting yourself in an isolation state just for a period of time, I still think really applies with what you're going to do. You have a family member get sick, you kind of put them off in that side of the house. It's not really an uncommon thought, but I think we're prepared to do that. And then I think we got to educate, and I think we got to be out there telling people. And I still think primary care and getting people preventative medicine to know what's going on with your body, kind of like going to get your oil checked. You know, somebody like, it's the oil check. Well, you find out how you prevent big repairs to have to happen. It still applies for your.
I was driving down 4th Street, actually, I think it was yesterday, and it struck me as I saw a helicopter land at the Pavilion over there that people are bringing triaged people here on helicopters. That must really say something about the hospital if they're taking them here versus KU or somewhere else.
So, and I will tell you right now, yes. And I think that ties back to, like I said, I mean, we're a full-blown emergency room with highly trained physicians to do what we need to do. Which is good because time, you hear the old adage, time is muscle. So from a heart attack standpoint, it's the same with your brain. From a stroke standpoint, there's medicines and there's things we can start preemptively in our emergency department that gives you a better chance of survival to then get you to a bigger hospital like Providence, or if we have to go to KU Health. And I think all those types of things, I mean, I don't think you have to go start at the big tertiary facility. I think our ease of use, you can walk up, you can walk in, you can get there. And it's a busy place. Plus we have that urgent care that if you're not as sick, that you can right next door, you can come in and get urgent care pretty much 5, sometimes 6 days a week to be able to get seen if you just need to get in for sniffles, sneezes, and coughs and things like that.
I have been there on a number of occasions. Obviously our primary physician is Dr. Angela Resch. Seen her since my kids were little and for a long time. What I found by going to your urgent care, though, is I've never had to wait more than 10 or 15 minutes. And I may jinx you here, but I've taken my son there. I've taken my spouse there. I've gone there. I've never had to wait more than 10 or 15 minutes.
Yeah, I've not heard of anything outside of that. Because to be honest with you, if you walk in the urgent care and you're like, oh my gosh, you're too sick to be in the urgent care, that's the benefit is we get you down the ER as quick as possible. Because sometimes, you got to get to the ER. But yes, that's pretty much our wait time. And we get in. And it's not because we're not seeing people. It's a busy urgent care. So I like I said, in a community like this, getting preventive medicine, understanding your body, getting information of because we're propaganded all over the place. I mean, we've got medicine commercials out there saying, talk to your doctor if, well, I don't know, in between the first half and the second half of a football game, you can talk yourself into having 3 different diseases just based on the medications they're selling you. So I think it's important to have those conversations with your doctor, not your television, to be honest with you, to find out what you really might need.
Well, how many people are having that conversation with their phone or the internet, and they come in diagnosing themselves and they find out that's really not what you have.
You know, it's funny you say that. In bigger communities, yeah, those sites really tend to push a lot differently. In smaller communities like Leavenworth, I do see a trust in healthcare a little bit differently, which is good, but it also means that you owe it to them to get them the right information at the right time and at the right level, because they trust you. They trust healthcare, which is good. I take that serious.
I think emergency rooms can be very difficult for people because you're coming in, people are having difficult times, they're upset. How quickly are people seen in the emergency room, and how much of a wait do you have there?
Well, it's going to be time dependent on the day, to be honest with you, or what's going on. We've had this big heat thing coming on, so we've actually had quite a few people coming in that, get a little bit too dehydrated and start getting a little bit sick. Our typical wait time to get triaged in and back to the back is around 10 to 15 minutes.
Oh, really?
And we set that as a goal for our physician to be able to see a patient within 10 to 15 minutes. So if you have to have labs, typically you got about a 45-minute turnaround time on getting your labs, x-rays, and things like that back. So our overall length to stay out of the ER to discharge is right at about 2 hours, which when you compare that to my competitors is actually really good. Mm-hmm. If you're a low acuity, meaning maybe you could have gone to an urgent care and you're seen in the ER, our goal is to get you out in 50 minutes.
Oh, wow.
So, and we're pretty good at hitting that. Or if not, I let Billie know that we need a little bit of improvement on it.
I think what the biggest complaint that I hear from people who go to the emergency room and that are admitted.
Oh, they're going to have the ride.
They got to have the ambulance up the hill. So they got to pay for an ambulance ride, or believe they have to pay for an ambulance ride to go up the hill.
And they don't have to pay for it. We do. So, I mean, as the regional CEO, it's one of the first things I looked at is, okay, what could we do different? You would think it would be cheaper to move the ER back up the hill than move the hospital down the hill. But the current environment where we're at, I don't have a solid plan of where we want to do. I want to connect those two back together somehow, some way, or utilize that space differently in what we're going to do. But that old ER up there would almost be probably cheaper for me to just build out and build a whole new ER next to the building, because it's not modern, and mm-hmm. it's built like an army barrack. I mean, I couldn't make it look like the one down the hill.
We've spent many nights in that old ER when my son wrestled or my dad had a heart attack. And yeah, we spent a lot of time there.
So it's we look at that for future use for different places and things like that. But no, I do hear, oh my gosh. And so we're actually, I've been having some different meetings with some different healthcare entities here in Leavenworth into, is there a way to potentially look at partnering for an ambulance that we could share to do things to make that a little bit, so you don't have to wait to go up the hill. So yeah, we're evaluating that to get there a little bit quicker.
Was the idea, and I'd heard this somewhere, that the idea was at some point the two buildings were going to be connected in some fashion.
I had not heard that. And like I said, in my 11 months here, I mean, that was a decision that was made way before I got here. It's weird to have the ER down the hill. But it's something I'm evaluating to figure out how do I pull them, how do I get them back together? So
interesting. What about staffing challenges? I know that most businesses in town are having some staffing challenges. I can't imagine it's easy to be staffing nurses and assistants and all of that. Has that been a struggle for you guys?
St. John's actually is a little bit better than my other 3 hospitals with where they're setting right now. And I think that, once again, that goes back to people want to work for a leader that cares about them. I think our biggest thing was really around certified nurse assistants. Has been one of the hardest things for us to be able to find. So we just recently approved a market rate adjustment to try to get people from driving out of Leavenworth to could stay here and do the kind of work we're doing. And that's probably been our biggest piece right now. So if we were to expand and open up an entire unit and I had to hire 30 people, I'd be sitting here going, man, it's hard to find people. But we've done a good job of actually maintaining what we have for the most part with our current volume. So I've been pretty pleased with that.
You guys do some work with the sisters in the nursing program too.
They do, very involved with that. And I think that's important to create that pipeline to get people to want to actually stay. Cool story is there was a young man that's getting ready to become our director of outreach. He's the person that's going to go around and talk to businesses and do a lot of different stuff. Was actually one of the sprint swimmers for St. Mary's. So he has made his way to come full circle to come back into the to the fold because of his proximity to the hospital, and he wanted to be a part of that. He's a super cool guy. I'm pretty excited about that. But yes, that program, I think having a nursing program to not only support your hospital here, but I think what it does economically for the community, all of that plays into a big part. So our relationship with them is unmeasurable.
When we came through, and I met Billie during the Lansing Leadership Chamber leadership class. And when we toured St. John's Hospital, first of all, everybody wanted to go up on the roof because it's an amazing site. You can see a lot of things in this community. But secondly, as they took us to some of the things and the tools that the nurses were learning on and how realistic some of those, I mean, they're not just dummies anymore. I mean, we're talking robotics here, and they're providing instant feedback. I mean, that is just amazing at the things that you're able to teach with the tools you have now. Can you talk a little bit about that?
Yeah, no, I mean, you've seen the evolution. Like I said, I'm old enough that like when I went to nursing school, they were true dummies of things we had to practice on to now they're full-blown simulators. From eyes blinking to your pupils below to they even have birthing simulators now.
Wow.
I mean, it's absolutely amazing the technology they have. I think the cool thing about that is one would think that you couldn't get that level of training in Leavenworth, right?
That's right.
And you can. And I mean, kudos and hats off to the college, right, for investing in the community to give a top-notch education. But then how are we involved with it? Well, we've got the space, we got the nurses, we help with the education of all that. So that's the level of people we want to hire, right? We want to know people that are trained. We want to know people that are loyal back to come here. And people that go to St. Mary's, I mean, it's amazing the number of people that stay in the community, they get educated there. And I think that's a testimony to the college. And I'd like to take a little credit and say it's a testimony for what the hospital needs. You know, I'm not taking credit, but I think definitely the hospital and the people that have been here for many years absolutely should.
So you just brought up the biggest question that I also hear about the hospital is, how come your guys aren't doing births there?
Yeah, well, I tell you, that's a national phenomenon that pretty much in community side, the way reimbursement is set up to hospitals is even in big cities, people are getting away from doing births and they're going to like one or two actual hospitals. To be able to actually have, it's not about money, but if you don't have money to do it, you can't. If I'm selling cookies and my cookies are more expensive than my ability to sell them, then I run out of cookies. It's really set up around your ability to be reimbursed and to have the program. And you look at the cost of a doctor to do that. It's not only their cost, but still it's one of the most litigious types of healthcare you can get into. So your insurance costs are very high. It's really pushing things to tertiary facilities to have these babies. So with that being said, what we have to do is have relationships with the facilities that are doing that to make sure the timing couldn't be any better. We actually do deliver babies. We did yesterday in our emergency department.
Oh, wow.
And so with that being said, I mean, I wouldn't promote people coming to have their baby in our emergency room. But once again, we have the relationship with the facilities that do that when that patient came in and needed to emergent to deliver, we were able to handle that, deliver the baby. Baby and mom were transported out. Mom and baby are doing great today.
Wow.
And so it's really not about that as much as it is we would consider opening up like OB or a GYN only clinic for female health. I know the VA is actually doing that right now. I had a meeting with them about a month ago. So what can we do to combine that to get preventative care and what we're going to do, or maybe even prenatal care we just wouldn't be able to deliver here. So I think there's ways to still support what we're trying to do locally with having a relationship with the bigger facilities who would actually deliver versus just you're on your own, call an Uber and get to the hospital or
good luck.
Whatever. Good luck. I mean, at least, like I said, as you and I have talked about babies before in board meetings, it's like, well, we delivered one yesterday. And so what is the timing of that, right? So
what healthcare need do you think is really unique to our community?
I don't think it's necessarily unique. I still think there's a lack of preventative care. I think in all communities, when you start looking at the disease processes, I mean, there's a patient involvement component that we get people in and, like I said, get them checked, get them preventatively looking at things before things get bad. There's two folds in smaller communities. One, there's either a reputation from something that happened a long time ago, or there's generations of people that just absolutely don't want to go to a hospital. It's nothing about the hospital. It's nothing about what we're trying to do. It's just they have a fear of going to the hospital, to the point when they get there, they're actually a lot sicker if they would have been seen 6 months ago. So I've said it 3 or 4 times in this podcast, if I could promote anything, it would be get preventative care, get involved with the hospital through not having to use the hospital, if that makes sense, through our primary care and through our diagnostics. And preventative medicine really goes a long way that would prevent you from having to do that. And I see that reproduce itself in smaller communities where smoking is still very prevalent and high cholesterol. Now, you're going to get told things you don't want to hear, like quit smoking and stop eating fried chicken. I'm kind of more of a, doctors will get mad at me more than once a week, but at the end of the day, it's really preventative. That's what I say.
Mental health and behavioral health is becoming a major issue in many communities. And I think especially in our community, what role does the hospital play in that?
So, well, right now, I mean, we're a huge role with it. We've got 30 beds. We have a senior behavioral health unit up there. We're blessed to have a physician that covers that unit that is absolutely one of the better senior behavioral health physicians I've worked with. We actually treat a higher acuity patient, because sometimes to qualify to be a geriatric patient in a behavioral health unit, you only have to be 55 or above. So I would qualify to be there. Now, with that being said, a lot of 70 or 80-year-olds have some behavioral type health issues, but then they got medical issues, and then they have different things that are maybe potentially mechanically or chemically affecting the brain. Our physician works on all aspects of that. So we actually keep a very high census because of that kind of relationship we have. It's an underserved area, and it's always full. It's always hard to get people out of. So that's actually a service line we're looking to expand. Right now, we're looking to bring on adolescent psych at Providence to support what we're doing, because it's such close proximity to here at St. John. And then I've been talking with Billie about what could we do to maybe expand some behavioral health services here, because once again, like you said, it's just it's a big need out there. And so,
3 to 5 years from now, what do you think St. John's is known for?
I think it's going to be patient-friendly, easy access to your emergency room, preventative care, and what we're trying to do. And in a 5-year standpoint, I think we will take away a lot of different things that you would have to drive to Kansas City for, going to other hospital around general surgery, orthopedic surgery, looking at those types of things to be able to bring back on probably within the next year. And then from a cardiovascular standpoint, continue to try to evolve, or maybe we wouldn't have to transfer people out of that. So I don't want to overpromise and underdeliver. But at the end of the day, these size communities, I mean, there's still people moving to the community, and you see that. And I think it needs to be a part of our recruitment to Leavenworth. Hey, we got a hospital, we got good healthcare, we got a college in town, we got great people, right? And I want to continue to stay here and be a part of the tax base and continue to grow and be a solution to everybody that's come to Leavenworth. Bring them over, let them see us, let us talk to them, and convince them to move here.
All right, we're going to rotate into our second segment now.
Okay.
We're going to know a little bit about Rick and some of your quirks and things you like, and maybe a little bit about your military career.
Okay.
So I call it rapid fire questions.
Okay.
Coffee, tea, or hospital cafeteria coffee?
I would say hospital coffee. I grew up on it, but speaking of military, having my first cup of coffee in a tin can makes hospital cafeteria coffee taste really good, even at my age.
Are you an early morning person or a late night problem solver?
Yes. In my role, it bookends.
What do you think one thing people would be surprised to learn about you?
I don't know. On a podcast, you can't see me. That my big exterior and my frame is I'm actually a really nice, kind person.
What was your first job before healthcare?
I worked at a detail shop.
Really?
In a car wash in Springfield, Missouri. Yeah, I closed it. So yeah, I'd buff cars and clean engines, and yeah.
What's one place in Leavenworth you think people should appreciate more?
Well, that's hard to say because there's so many things. I mean, I got the relationship with the VA. I think the VA there, I mean, obviously the fort is just absolutely amazing with what it brings. And it brings a rotation of people. It always kind of gives it just a little bit of a fresh look, which is fun. It kind of helps us not be stagnant. So maybe that would be. What
do you do to clear your head after a long day?
I walk. Here lately, I've been walking like a lot. So, my wife and I like on weekends or whatever, I try to get at least 3 mile walk in every day. So that's my put on the headphones, maybe listen to a podcast worth listening to, and go.
If you weren't in healthcare, what do you think you'd be doing?
I would probably be teaching.
Really?
Yeah,
that's interesting.
It is interesting. I kind of had the desire to go back and get a doctorate and maybe be at an academic level in one of the bigger universities. Or, yeah, I don't know if I'd have said that 15 years ago.
Yeah.
At the end of a career, maybe taking a little bit of what I know and sharing some of that with others would be probably what I would do.
What's the first thing that basic training taught you to do fast?
Not talk back to your drill sergeant would be the first one. You went from being able to do 20 solid push-ups to 100 pretty quick.
Okay. What's harder, basic training or your first year in the hospital leadership?
Ooh. I'd say first year in leadership because you knew basic training was going to be hard.
Okay.
Right. So you mentally prepared to go into it. First year hospital leadership was kind of like, oh, look at me, I'm a leader. And you're like, oh, wait a minute, what have I done here? I knew what I was getting into going into basic training.
What's one Army habit you still use today?
My sock drawer. My sock drawer, t-shirts, and shirts hung up in the closet. I've been married for 34 years, and I'll tell you, my wife will hang up my shirts, and periodically there's one that maybe isn't hung right where it needs to be. So,
best advice you received from someone in the military?
Keep your head down. For anybody listening to this, as military would understand that is control the things that you're able to control and support the people around you to create a team environment.
Wow.
And that's a good leadership principle forever, right?
That's pretty deep, actually. What did you learn faster, military acronyms or healthcare acronyms?
Well, being a medic in the military, I had to do both. So you think about that. So you got out of basic training and learning all those, and then boom, you went into one of your first things was really a medical terminology class through medic school. So you're doing both, right? Your NCO comes into, to teach you about your abbreviations. So I kind of do it at the same time.
Okay. Most underrated job in the hospital?
Oh gosh. There's so many of them. I mean, from your food nutrition services people that prepare meals, I tell you, people are still motivated through the stomach. They feel home when they feel like they've had a good meal. Now the contrary to the piece of that is some people don't like having no salt, no sugar, no butter stuff. The people that clean the hospital, you think about it, they're frontline, they're talking to people. Your perception of clean, your perception of pathogens is going to come from having a clean hospital. So I think those positions you need them, but I don't think people realize. I go into a room with those employees and clinical people, and I'll say, raise your hand if you're clinical. And of course, all the nurses and CNAs will raise their hands. The others that are sitting there, I said, you guys need to raise your hand because you're a part of this clinical team, because you're clinically making people the right way. So don't ever think you're not a part of the clinical story.
Oh, that's a good story.
And so, because I don't mean it badly, but cleaning a hospital room is different than cleaning a bank office. So they just need to know they're a part of the bigger story.
One thing patients should bring to every appointment.
Their medication list. You knew they were going to say that. I mean, it's a hard one to do, and an accurate medication list. How about that? So many times, polypharmacy and different things going on. The best way to treat you is to know what you're taking. I can get a good history and physical off of your pill case. Going, oh, I didn't know you had Crohn's disease based on your pill. You didn't have to tell me that. I just knew what you were on. So a good, accurate medication list, how you're taking it, and are you compliant with it? Probably be your best thing. And for the people that don't have that, then bring your spouse or significant other with you to tell them.
Most misunderstood part of the hospital leadership.
I think a lot of people think we just started at the top. And in healthcare, I will tell you, it is somewhat of a higher. I'm kind of a unique person to get to a regional CEO that went from a CNA all the way up to a regional CEO. But I'll tell you, my son's in healthcare. He's a chief operating officer in a hospital in a different state. Mm-hmm. And I will tell you, he started off working as a anesthesia tech during grad school. It's that we actually have to spend time doing the work of people, learning what we're trying to do to then become better leaders as we get our leadership degrees and move. So you don't just start there. It does come with practical knowledge of what happens in a hospital.
What should Leavenworth residents be optimistic about when it comes to St. John's?
Well, first and foremost, if people don't know St. John, I never wish anybody to have to come to the hospital, ever. If they do have to, I want them to have the confidence that they're going to be treated very well. Like we've already talked about the services, we talked about the emergency room. If there's questions about them, I would want the community to reach out. They want a tour? Come look at the hospital and tour it. You want to meet doctors before you pick one? Let us know. We'll let you interview doctors. It's whatever they need to do to feel comfortable with there, because at the end of the day, no one wants to go to the ER. Problem is that they're there because we have to sometimes. And so I really want them to feel comfortable with the hospital and the direction. I want them to have a voice for things that we can get. It doesn't mean I can just say, hey, we're going to start doing babies in the next 2 years. But what I will say is that we are evaluating how do we make sure that the community is taken care of. If we're not doing that, there's alternate plans, and I want them to be educated with that.
Rick, that's everything. I appreciate you coming on the podcast today. Is there anything else you'd like to tell our audience before we sign out?
No, I just really appreciate the time today, and hopefully this has been a way to get people to want to learn more about the hospital. Or we have volunteer programs over there too, that if someone wants to get involved from a volunteer standpoint or come over and do things, I mean, have them talk to Billie Leonard, the chief administrative officer. She talk to anybody and make that happen. But no, I'm proud of what we've got going on here. I spend at least one day a week here in Leavenworth. So if anybody needs access to me to talk about anything, I'd always be available to do that.
That's awesome. I will say, of all the boards I'm on, the hospital board is my favorite, simply because you guys have the best food. And you said earlier, the best way is through your stomach. Then definitely, for sure.
Exactly.
The best food. Billie always makes sure that we're fed really well as we go through all that stuff. So
it's good food.
I always look forward to that meeting. Thank you so much for being here. I really appreciate you. And if you have a chance, visit the hospital.
Great. Thanks, guys.